If you're a business professional and you're struggling with health insurance after shifting to part-time or consulting work, this episode's for you. Today, I'm unpacking why health coverage can feel like a nightmare for part-timers and how to get ahead of it without sacrificing income, energy, or peace of mind. Let's get into it.
You're watching My Hybrid Retirement Weekly, the show that helps professionals work less, earn smarter, and embrace more financial freedom. Hosted by Rob Leiphart, a fiduciary advisor. New episodes drop every Tuesday at 12 p.m. Eastern. Subscribe now and start planning retirement on your own terms.
Hi, everyone. Rob Leiphart here, helping you build long-term financial independence with work-life balance. This week on My Hybrid Retirement Weekly, we're digging into one of the most overlooked stress points for professionals who've scaled back their hours: health insurance. Whether you're working fewer days, consulting, or running a small business, you still need coverage. But good luck finding a plan that's affordable, flexible, and actually makes sense. Let me ask you this. If health insurance weren't such a pain point, would you have made the leap into part-time work sooner? Drop your answers in the comments if you're joining us live on LinkedIn or Facebook. So here's what I'm seeing. A lot of professionals step into part-time work thinking they've got the income part handled, but the healthcare piece blindsides them. And the reality check? Employer-sponsored coverage, gone. COBRA? It's expensive and temporary. Marketplace plans under the ACA? Confusing and income sensitive. And Medicare? Still years away. The system just wasn't built for flexible workers or hybrid retirees. That's why so many folks feel stuck, either tied to a job for benefits or rolling the dice with coverage that doesn't match their needs.
Employer-sponsored health insurance isn't common for part-time employees. According to the Bureau of Labor Statistics, only 26% of employees with part-time jobs have employer-sponsored coverage. But providing your part-time workers with a health plan can be beneficial. When employers offer health benefits to their part-time workers, they can better attract and retain talent. They can also help promote a healthy workforce and show employees they care about their well-being. A cost-effective way to do this is through a standalone Health Reimbursement Arrangement, or HRA. An HRA allows you to reimburse your employees for their individual health plan premiums instead of buying a group plan for them. You can also reimburse them for more than 200 other qualifying medical expenses, like over-the-counter medication.
Let's talk about the actual risk here, because this isn't just about premiums and deductibles. First, unpredictable medical costs. Without the right coverage, one emergency room visit can wreak havoc on your budget for the entire year. Second, stress erodes strategy. You can't focus on your business, your family, or your future if you're constantly worried about coverage gaps. And third, retirement plans get delayed. I've seen clients delay retiring or going part-time just to keep their health insurance. That's not freedom, that's fear-based planning. And fear has no place in a well-built financial plan.
If you have lost your job or quit your job and you're considering COBRA coverage, do take into consideration that you can expect that your monthly premium is going to at least double. However, if you need to maintain that coverage because perhaps you're currently undergoing care, again, remember that losing COBRA when your COBRA coverage actually terminates, that won't qualify you for a special enrollment period, unlike losing creditable coverage through your employer. So make sure you time it out that when your COBRA coverage ends, it's at that point open enrollment, so that way you can enroll in a marketplace plan, or at the very least, make sure to terminate your COBRA coverage early to make sure you can enroll in a marketplace plan during the open enrollment period.
Here's where it gets encouraging, because there are solutions. I've worked with clients in this exact position, and here's what I've seen work. Tax-smart income planning. What about hypothetically lowering your taxable income strategically to qualify for ACA or American Care Act subsidies without cutting into your lifestyle? Or creative coverage strategies, pairing high deductible plans with HSAs, or even private PPO options when it makes sense. Or benefit-driven part-time work. Some take on flexible roles just for the benefits. Think of universities, health systems, or even certain retailers. And last, spousal timing. Coordinating transitions around your spouse's plan can open up better options and reduce gaps. And I'll use myself as an example. When I was starting my business as a sole proprietor, I didn't have healthcare coverage. I relied on my spouse for her coverage through her employer. And when she got laid off, we found ourselves on COBRA, paying a lot more than what the plan actually cost. And then we sought coverage through the ACA. And fortunately, with my wife being unemployed at the time, her income was reduced, and that allowed us to have greater credits available through the ACA. And that helped defray some of the costs of those premiums, which can be extremely high without some sort of tax subsidy. Same care, better outcome, and more breathing room.
So most people think the Affordable Care Act is some substandard form of insurance that's designed for people that can't afford any type of health insurance at all. But nothing could be further from the truth. The Affordable Care Act, or what is affectionately called Obamacare, is just a set of laws that change the rules by which health insurance companies have to operate. The first thing it did is it forced insurance companies to insure everybody the same regardless of their pre-existing condition. Prior to the Affordable Care Act, a healthy person got a really good rate on health insurance, but an unhealthy person had a hard time finding coverage at all. The Affordable Care Act fixed that, where now everybody's insured the same. Additionally, the Affordable Care Act offered subsidies to help people pay the high cost of health insurance premiums. And this has been hugely helpful for people that have a budget. And the last thing the Affordable Care Act did is it provided a set number of benefits that every company has to cover. Things like maternity services, mental health benefits, hospitalization, and prescription coverage. That's the Affordable Care Act.
Let's hit a few questions I get all the time. Can I get ACA subsidies even with retirement income? Yes. If you manage your modified adjusted gross income properly. And also think about asset location, HSAs, and capital gains planning. All these avenues have a role. Are health sharing ministries worth it? For some, yes, but understand they're not insurance and claims aren't guaranteed. They can be a bridge, but not a full strategy. Should I get a part-time job just for the benefits? If the job aligns with your values and lifestyle, absolutely. But don't do it just for the perks. The plan has to serve your bigger vision. What happens once I hit Medicare age? Well, that's great. And it opens up new doors, but choosing the right Medicare plan is just as important. And if your spouse isn't Medicare eligible yet, that transition still needs planning. Have more questions? Drop them in the comments. I might feature yours in next week's episode. Here's what I want you to take away from today's episode. Don't let health insurance derail your hybrid retirement. Build your income strategy with healthcare costs in mind. And third, use creative coverage solutions that match your phase of life. Remember, the goal isn't just to be covered, it's to be confident. Now picture this. You're consulting 3 days a week, your income is steady, your time is yours, and your healthcare covered without anxiety or sacrifice. You're spending more time with your grandkids or serving your community, or maybe even starting that passion project you shelved 10 years ago. That's what a well-built hybrid retirement makes possible. And that's the kind of freedom we're building here together. If you found today's conversation helpful, hit that subscribe button and join me every Tuesday at noon for my Hybrid Retirement Weekly. And if you're ready to ditch the hustle culture and build a flexible, values-based income plan, let's talk. Book a free discovery call. We'll map out your hybrid retirement strategy, health insurance included. Thanks for joining me today. Just remember, your income is more than numbers. It's freedom, it's purpose, it's the life you're meant to live. See you next week on My Hybrid Retirement Weekly.
Thank you.